Today I want to share with you a couple techniques on how to self-treat headaches without using any medication. But before I do that, I want to talk a little bit about what pain is. So acute pain and chronic pain are processed very differently in the brain. And I bring that up because often people that experience headaches have some sort of chronicity to their symptoms. So pain is both a sensory and an emotional experience regarding actual or potential tissue damage. And there's a lot of factors that play into how our brain decides to process and perceive that noxious stimuli. Two of those are our sleep hygiene and our stress level. So if we are in a sleep-deprived, high-stress state, since we are designed for survival, our brain thinks we are in a very dangerous environment. And we need to have very sensitive nerve endings in order to gain all kinds of information from external stimuli to run from that tiger or get out of that life-threatening situation. Most of us day to day are not in life-threatening situations, so we need to address sleep, make sure that we're getting at least 7 to 9 hours a night, and make sure that we're doing some sort of relaxation techniques or something meaningful to bring down our stress level. Once we've addressed those two components, then we can move on to the musculoskeletal implications. So when we experience a headache, the natural tendency is to shrink into ourselves, which perpetuates this vicious cycle of shortening and tightening these already painful muscles. So what we're going to do is stretch, elongate, relax these shoulder elevators. So sit down in a chair and you're going to do this contract, relax technique where you are pulling up and activating your upper traps for just a few seconds and then gently applying some overpressure to the side. You should feel a stretch along your upper trap, and then we'll go into your levator scapulae, which is another shoulder elevator, looking down into that opposite underarm and pulling in that direction. So 2 sets of 20 for both the upper trap and levator scap. So if you feel like your headache originates from your suboccipital muscles or the muscles that are at the base of your skull, this is going to be a relaxation technique to try to get those muscles to relax and release. So I like using the peanut lacrosse balls. You can get those for a few bucks online. Or if you don't have one of those, you can use anything that's going to apply some pressure. I'm going to use a metal water bottle right now. So I'm going to put that right at the base of my skull, a little bit of a chin tuck, and I'm just going to relax here for 2 minutes. So next time you experience a headache, instead of immediately popping an NSAID like Advil or Aleve, let's look at your sleep hygiene, stress levels, and then get into relaxing these postural muscles that get into that shortened position when most people are experiencing headaches. As always, if you have any questions, or if you want a more tailored plan for you, then shoot me a message or an email.